Hello, and thank you for watching this educational video about your health plan. This presentation is intended to be an instructional opportunity about your KPP-free benefit. The Kempton Group is an independent third-party administrator, or TPA, that was founded in 1969. The Kempton Group is the TPA for the KPP-free program adopted by your employer. Your health benefits are offered through a self-funded health plan. This means that your employer is directly responsible for paying your claims rather than purchasing an insurance product to shift that responsibility to a third-party insurance carrier. More than 60% of all employee benefits are provided by a self-funded plan in the United States. Throughout the year, as you and your family make healthcare purchasing decisions, remember that any money you save stays with your employer. These savings can help offset future costs or be used for other operational needs. Even though your main medical plan may use a PPO network to access local providers, the network negotiated price may not always be the best price. It is valuable for you to understand the role and operation of a PPO network. Networks negotiate discounts off the medical provider's billed charges in exchange for funneling volume to these providers. However, medical providers decide what their billed charges will be. Different medical providers charge different rates for their services, even within the same community. So, the starting point, or billed charge, varies depending on which medical provider is chosen. Even if the PPO network negotiates a discount of 50% off billed charges, if the provider's charge is high, the result may not be a fair or reasonable payment. The discount negotiated by the network is often different for each medical provider. I'm sure you will agree that 50% off of $1,000 is still more money than 50% off of $100. Here are some examples. In this graph, common procedures are listed with the highest price and lowest price paid by a self-funded employer in Oklahoma City. These prices are actually amounts paid by your plan after the network discount was applied. You can see that the cost variation between the low payment and the high payment is extreme. The average difference in Oklahoma City is 757%. If you compare this variation to the price of a gallon of gasoline, it would be like a gas station on the north side of the street charging $2.50 per gallon, while the gas station on the south side of the street would charge you $18.93. The variation is common in every community. Let's look at some other markets. Obviously, using a network provider does not guarantee a valuable price. Providers rarely offer their best price to a network or insurance company. Medical providers generally offer their best prices to patients who can pay cash. The bills displayed on your screen are from a patient who had an emergency room visit at a hospital in Pennsylvania. The patient did not provide their medical insurance ID card that indicated their insurance provider to the hospital prior to treatment. Without a copy of the ID card, the patient was listed as a self-pay or cash pay patient. The patient received a bill for the medical services in September for $1,000. The patient assumed, as most of us would, that his out-of-pocket would be less if he had the hospital refile the claim with his insurance company. Since the hospital was in-network, he believed the network discount would reduce the charges. After the hospital filed the claim with the patient's insurance carrier, they sent a new bill a few months later. The patient was now being billed $1,752.80. The amount the patient owed increased after the bill was filed and the discount applied. If your plan does not access a PPO network, you may choose any physician, facility, or other medical provider based on the value that you place on the services they provide. Since the networks do not always negotiate the best deal for you and your plan, the network's influence has been eliminated. You are free to use the provider of your choice without an in or out of network benefit differential. To determine the plan's allowable provider reimbursement, your plan utilizes reference-based pricing. For plans that use reference-based pricing, KPP-free is your easy button. Your employer is providing an option to help save you money and assist you with making better healthcare buying choices. By using KPP Free, you can have your medical services covered at 100% with all out-of-pocket expenses waived, while still saving money for the plan. Please note this important reminder. Under IRS guidelines, with the exception of ACA-mandated preventive services, participants enrolled in a qualified high-deductible health plan must meet their deductible before receiving a 100% benefit. Your employer offers a 100% benefit for services available under KPP Free because these providers offer their best prices to your health plan. Displayed on your screen are comparisons between pricing paid with a network discount versus the price for the same procedure through the KPP Free program. These are actual claims paid by a local self-funded employer. For example, let's take a look at a laparoscopic gallbladder removal on the left side of your screen. Commonly, the billed charges for this procedure exceed $39,000. With a network's negotiation, that bill is discounted at $35,000, which seems like a great deal. But one of the facilities that participates in the KPP Free program has a total price of $6,550 for the exact same procedure. The KPP Free price, which is also the provider's cash price, is more than $28,000 less than what the network negotiated. Another example is for a diagnostic colonoscopy. Again, a common billed charge for a diagnostic colonoscopy is more than $19,000. With a network negotiation, that bill can be discounted to $15,000. A KPP Free provider offers a cash price to your health plan of $1,800. Here are some other examples of some common procedures. As you can see, the difference is remarkable. This is an example of a procedure that a patient may not consider being available through KPP Free. Sometimes cardiac procedures are performed on an emergency basis. However, often these procedures are able to be scheduled. There are participating KPP Free providers that offer many inpatient cardiac procedures through this program. The program has been very successful since its inception in 2012. There have been nearly 10,000 procedures performed through the KPP program, and clients of the Kempton Group have saved more than $60 million. That savings does not include the out-of-pocket costs that members like you have saved. When participants voluntarily choose KPP Free, the savings really add up, benefiting both the plan and the participant. The KPP Free program has grown from one provider in 2012 to more than 100 providers in multiple states. For a complete and up-to-date list of providers that participate in the KPP Free program, visit kppfree.com. Remember, you may be eligible to receive reasonable reimbursement for travel and lodging. Please call and speak with a Kempton Care advocate if you're interested in seeking benefits through the KPP Free program. And remember, KPP Free services must be coordinated through Kempton prior to receiving care. An extension of the KPP Free program is the Consumer-Driven Cash Price Agreement. A cash price agreement allows the medical provider of your choice to be reimbursed at the enhanced KPP Free benefit. If you are able to negotiate with your current medical provider to match or closely approximate the KPP Free price for your procedure can be covered under the enhanced benefit. Contact the Kempton Care advocates about obtaining a cash price agreement that you can present to your medical provider. For medical services received under a cash price agreement, the benefit will be the same as the KPP Free benefit, which means the patient responsibility is waived and 100% of the procedure is paid by your employer. Don't forget, participants enrolled in a high deductible health plan must meet their deductible before receiving a 100% benefit. Using the KPP Free program is really as easy as 1, 2, free. Let's go through 3 steps. Step 1. After your doctor indicates that you need surgery, diagnostic imaging, or other procedure, let them know you have an enhanced benefit available to you. With the doctor's orders, contact a Kempton Care advocate who will help you determine whether your procedure can be done through KPP Free, what providers offer the procedure, and walk you through the process. Now on to step 2. If you decide to move forward with using the KPP-Free program, you will receive a KPP-Free voucher. Give the KPP-Free voucher to the provider at your appointment. This voucher is like a boarding pass that designates you as a VIP and gives the provider instructions on how to submit their invoice. This is very important. Present your voucher to the KPP-Free provider. It is imperative that you do not present your health plan ID card when you arrive for your consultation, your procedure, or your follow-up at the KPP-Free provider. If the provider files the claim using the information provided on your medical plan ID card, your regular plan benefits, including deductibles and coinsurance, will apply. And now on to step 3. Have your procedure or your surgery. Procedures and services provided through the KPP-Free program are covered at 100%, waiving all patient responsibility. Many medical services are available through KPP-Free, such as orthopedic procedures, diagnostic imaging, general surgeries, urology, ear, nose, and throat, gynecology, oncology, inpatient cardiac testing, bariatric, digestive testing, sleep studies, and many more. Remember that to get started, a participant generally needs physician's orders. To learn more about the KPP-Free program or to start the process, call and speak to a Kempton Care advocate. If you have questions or would like to schedule your procedure, please call us to speak with a Kempton Care advocate. They are available Monday through Friday, 8 a.m. to 5 p.m. Central Standard Time. Additional information is also available at kppfree.com.